Top 10 medications that could be destroying your prostate health, the shocking truth. Are you unknowingly putting your prostate at risk? Every day, millions of men take medications that seem harmless, until they start experiencing frequent bathroom trips, difficulty urinating, or even painful retention. If this sounds familiar, your medicine cabinet might be the hidden culprit. The truth is, certain medications could be slowly wreaking havoc on your prostate, making symptoms of BPH, benign prostatic hyperplasia, worse and increasing the risk of serious complications. Let's break down the top 10 offenders so you know what to avoid and what to do instead. 1. Antihistamines. The allergy relief that blocks your bladder. Allergy season hits, and like clockwork, you reach for relief. But what if that little pill is weakening your bladder muscles? Antihistamines like Benadryl, Claritin, Zyrtec, and chlorotrimazole work by reducing bladder contractions. While that's great for allergies, it's terrible for your prostate because it can make it harder to fully empty your bladder. Imagine feeling like you have to go, but nothing happens. If you have an enlarged prostate, this could quickly turn into a serious problem. 2. Decongestants. Clear your nose, clog your urine flow. You pop a Sudafed to clear your sinuses, but little do you know it's also tightening muscles around your bladder and prostate. Decongestants like Sudafed and Dayquil stimulate alpha-adrenergic receptors, which constrict your bladder muscles. That means weak urine flow, trouble starting, and frequent urges that lead to nothing but frustration. If you already struggle with urination, these medications can turn your bathroom trips into a nightmare. 3. Diuretics. The water pills that pressure your prostate. Doctors often prescribe diuretics for high blood pressure and heart conditions, but they come with a catch: frequent urination. Medications like Lasix, HCTZ, and aldactone increase urine production, which sounds harmless until your bladder is constantly irritated. If you have prostate problems, this excessive urination can make symptoms unbearable and increase the risk of infections. 4. Antidepressants. The mood boost that weakens your bladder. Depression is tough, and antidepressants can be life-changing. But did you know they could also be interfering with your bladder's ability to function properly? Medications like Prozac, Zoloft, Elavil, and Paxil can weaken the nerve signals that control bladder contractions. This often leads to urinary retention, meaning your bladder never fully empties. Over time, this puts more pressure on your prostate, making everything worse. 5. Opioids. Pain relief that paralyzes your bladder. Opioids like morphine, oxycodone, hydrocodone, and codeine don't just numb pain, they also slow down bladder function. If you already have an enlarged prostate, this can be a disaster. Opioids make it harder to empty your bladder, increasing pressure and discomfort. Over time, this can even cause serious complications, like infections or kidney damage. 6. Alpha-adrenergic agonists. Meds that squeeze your prostate. Medications like midodrine and phenylephrine are commonly used to treat low blood pressure or nasal congestion, but they have a dark side. They tighten the muscles in the bladder and prostate, which makes it incredibly difficult to urinate. If you're already dealing with a slow or weak urine stream, these medications can make it 10 times worse. 7. Anticholinergics. The silent prostate saboteurs. Used to treat asthma, Parkinson's disease, and overactive bladder, anticholinergics may seem helpful, but they can completely shut down bladder function. Medications like Ditropan, Detrol, Atrovent, and scopolamine block the communication between the bladder and the brain. The result? Your bladder doesn't empty properly, and your prostate takes the hit. 8. Testosterone supplements. Fueling prostate growth. Testosterone therapy might boost energy, muscle mass, and libido, but it can also accelerate prostate growth. Supplements like Depo-testosterone, Androgel, and Androderm can worsen BPH symptoms and even increase the risk of prostate cancer. If you're on testosterone therapy, regular prostate screenings are a must. 9. NSAIDs. Painkillers that poke your prostate. NSAIDs like ibuprofen, naproxen, and aspirin are common pain relievers, but frequent use can cause bladder irritation and exacerbate prostate symptoms. While occasional use is fine, chronic NSAID use can lead to inflammation and discomfort that puts even more stress on your prostate. 10. Antipsychotics. The double-edged sword. Antipsychotic medications like Risperdal, Haldol, Zyprexa, and Seroquel help manage serious mental health conditions, but they also interfere with the coordination between your bladder and prostate. This can result in weak urine flow, increased urgency, and even complete urinary retention. The bottom line: take action now. If you're taking any of these medications and noticing changes in your urination patterns, don't ignore it. Check your medications, talk to your doctor about safer alternatives, and never assume that frequent bathroom trips are just a normal part of aging. Your prostate health is in your hands. Don't wait until it's too late. Medical disclaimer. This article is for informational purposes only and should not be considered medical advice. Always consult with your doctor before making any changes to your medication or treatment plan. Your health is too important to leave to chance.